Hi, this is Dr. Sharma from Colonel's Dental Spa, Bangalore, India. Gum diseases is a very common occurrence in the populace, and in individuals it generally goes unnoticed. Most of us don't give much attention to gum diseases, but the truth is that the gum disease is one of the most common health problems in the body all over the world. Gum diseases starts with bacteria and plaque which is accumulated on the tooth surface. It all comes with the food that we eat. The more processed food we eat, the more bacteria gets accumulated inside the mouth. The good news is that we have a solution to stop it, and we have the power to stop it. Simple home care habits by brushing every day in the morning as well as in the night before you hit the bed, once after breakfast and once after dinner. Floss every day once in the night before sleeping in the night, and visit a dentist periodically even if you don't have pain. Stay well, eat well, and keep yourself hydrated. Avoid smoking. These are the simple methods with which you can prevent gum diseases. Gum diseases are pretty sneaky. They are pretty hidden. It's common that it can cause serious damage, and even if you don't catch it early. In gum diseases, the gums become red, they become swollen, they bleed while brushing or flossing, and that is a red flag. If you notice that there is a foul smell from the mouth which does not go away, the gums are a little tender, you can't take pressure on your teeth and you avoid chewing on that side. You also feel sometimes when the gums are receding, it shows as if the teeth are becoming a little longer. These are signs too that the gums are infected and require attention. Today, I want to clear upon some common questions. Are gum diseases reversible? The answer is yes, but then there is a catch. It depends upon how early you catch it and how early you intervene with the dentist, how to clear the infection. If the gum disease or the gum infection is in the early stage, it is called gingivitis. It's a simple infection of your gums where the gums may be a little swollen, there may be little bleeding while brushing your teeth, which is a sign enough for one to visit a dentist. At this stage, the gum diseases, it is treated, it is reversible. The gum may be inflamed, there may not be much of bone loss, but then a little intervention from the dentist by counseling as well as scaling and polishing and educating the patient towards the maintenance of oral hygiene on a daily basis and at home is something which can cause the gum disease to reverse. If the gum disease is not intervened at the stage of gingivitis early, then this infection burrows a little deeper inside the gums. When it burrows deeper inside the gums, then it becomes a little more serious because the periodontium, I don't want to go into technical jargon, the gums which are surrounding the tooth structure at a deeper level, they become a little more infected. And then there is a gap which develops between the gum and the tooth surface where more and more food starts getting, stuck. And bacteria grow more easily inside that, and the gums bleed a little more. The symptoms of a little bit of discomfort and pain and not able to, put pressure on that side, the symptoms become a little more heavier. We can also notice that the gums are receding a little more, and if left untreated, the tooth can also start shaking a little bit. For this, more professional help is required. A little more intervention by the dentist is required, where deep periodontal cleaning or a professional cleaning is required. Antibiotics may help to support the infection, but at the same time, sometimes a small surgical intervention which we at Colonel's Dental Spa do, which is called the laser gingivectomy, where the infected gums are removed with a laser, and if required, a laser flap intervention is where the reattachment of the gums onto the tooth surface. These are treatments which are available at Colonel's Dental Spa. These are recommended, and then if the patient maintains the protocol at home, because treatment or maintenance is as important as the treatment done in the clinic, and this maintenance has to be done at home, for which we handhold the patient and counsel him and make sure that the condition becomes reversible. With periodontitis, the infection goes deeper, infecting not only the gums but then the supporting bone. And mind you, it is not the gums which hold the teeth strongly inside the jaw. It is the bone under the gums that holds the bone. So, infection from the gums can percolate into the bone. And once it goes into the bone starts receding with a period of time. And then once the bone starts receding, its hold on the tooth becomes weaker. To put it in a simple way, if more than 50% bone is lost, the tooth starts shaking. And if this goes untreated, there may be chances that a person might lose the tooth. It is the foundation that gets affected.